Cardiovascular disease is a big term. It means any disease that affects your heart or blood vessels. These diseases are very serious. They can lead to a heart attack, stroke, or even death. Millions of people around the world are affected by cardiovascular disease. That's why it's so important to understand what it is and how to prevent it. Some of the most common types of cardiovascular disease are coronary artery disease, hypertension, heart attack, and stroke. Coronary artery disease happens when the arteries that supply blood to your heart become narrowed or blocked. Hypertension, also known as high blood pressure, is another common type of cardiovascular disease. High blood pressure makes your heart work harder and can damage your arteries over time. A heart attack occurs when the blood flow to a part of your heart is blocked. This is a medical emergency and requires immediate attention. A stroke happens when the blood supply to your brain is interrupted, often due to a blood clot. Like a heart attack, a stroke is a serious medical emergency. Several factors can contribute to the development of cardiovascular disease. One major culprit is atherosclerosis. Atherosclerosis is the buildup of plaque in the arteries, which are the blood vessels that carry oxygen-rich blood throughout your body. Plaque is made up of cholesterol, fat, and other substances. Over time, plaque hardens and narrows the arteries, making it difficult for blood to flow through. This can lead to a heart attack or stroke. Another major risk factor is hypertension, or high blood pressure. High blood pressure means your heart has to work harder to pump blood throughout your body. This can damage your arteries and increase your risk of heart attack, stroke, and other health problems. Lifestyle factors also play a crucial role in cardiovascular health. Smoking, for example, damages your blood vessels and increases your risk of heart disease. A diet high in saturated and trans fats can lead to plaque buildup in your arteries. Lack of physical activity can weaken your heart and make it harder for your body to control your weight and blood sugar levels. The good news is that there are many things you can do to lower your risk of developing cardiovascular disease. Making healthy lifestyle choices can make a big difference. One of the most important steps you can take is to eat a heart-healthy diet. This means choosing foods that are low in saturated and trans fats, cholesterol, and sodium. Focus on fruits, vegetables, whole grains, lean protein sources, and low-fat dairy products. Regular physical activity is also essential for a healthy heart. Aim for at least 30 minutes of moderate intensity exercise most days of the week. If you smoke, quitting is one of the best things you can do for your heart health. Smoking damages your blood vessels and increases your risk of blood clots, heart attack, and stroke. Limiting alcohol intake is also important. If you choose to drink alcohol, do so in moderation. For women, that means up to 1 drink per day, and for men, up to 2 drinks per day. These lifestyle changes may seem simple, but they can have a profound impact on your heart health. Section 4. Medical treatments for heart disease. If you are diagnosed with cardiovascular disease, your doctor may recommend medications to help manage your condition. There are many different types of medications available, and the best option for you will depend on your individual needs. Some common medications used to treat cardiovascular disease include statins, aspirin, beta blockers, and ACE inhibitors. Statins help lower cholesterol levels in your blood, which can help reduce plaque buildup in your arteries. Aspirin helps prevent blood clots, which can reduce your risk of heart attack and stroke. Beta blockers help slow your heart rate and lower your blood pressure, which can reduce stress on your heart. ACE inhibitors also help lower blood pressure and can be used to treat heart failure. In some cases, your doctor may recommend medical procedures to treat your cardiovascular disease. Angioplasty, for example, is a procedure that opens blocked or narrowed arteries. During angioplasty, a small balloon is inserted into the blocked artery and inflated to open it up. Bypass surgery is another procedure that may be recommended for people with severe coronary artery disease. During bypass surgery, a healthy blood vessel is taken from another part of your body and used to create a detour around the blocked artery. Section 5. Keeping your heart healthy. Monitoring and checkups. Regular monitoring and checkups are crucial for maintaining good heart health. Even if you feel fine, it's essential to see your doctor for regular checkups. This is because many cardiovascular diseases don't have any symptoms in their early stages. During a checkup, your doctor will check your blood pressure, cholesterol levels, and weight. These simple tests can help identify any potential problems early on, when they are easier to treat. Your doctor may also recommend other tests, such as an electrocardiogram or EKG, and an echocardiogram to assess your heart health. An EKG measures your heart's electrical activity, while an echocardiogram uses sound waves to create images of your heart. By staying on top of your heart health with regular monitoring and checkups, you can catch any potential problems early on and reduce your risk of serious complications. Section 6. Preventing heart disease. Simple steps for a long life. Preventing cardiovascular disease is an ongoing process that requires a commitment to a healthy lifestyle. By making simple changes to your daily routine, you can significantly reduce your risk of developing heart problems. One of the most important things you can do is to engage in regular physical activity. Aim for at least 30 minutes of moderate intensity exercise most days of the week. This could include brisk walking, jogging, cycling, swimming, or any activity that gets your heart rate up. In addition to exercise, maintaining a healthy weight is crucial for heart health. Being overweight or obese increases your risk of developing cardiovascular disease. You can achieve a healthy weight by combining a balanced diet with regular physical activity. Finally, managing stress is essential for overall well-being, including heart health. Chronic stress can contribute to high blood pressure, unhealthy habits, and other risk factors for cardiovascular disease. Find healthy ways to manage stress, such as exercise, yoga, meditation, or spending time in nature.